Yung paano ko? Yung pag lumbayan.
afternoon, everybody. We are live now. Hi. Let me just check with Doc Ian if he's in place, but he's already here. Thank you for joining. Hi, Darius. How's everybody? I hope everybody's going well. Um, it's 3:02 p.m. Let's not wait any longer. Let's start our YouTube live. Welcome everybody. Good afternoon from Singapore, and Doc Ian is streaming live in Cebu, Philippines. And good morning and good evening to the rest of the world, wherever you are. Thank you for watching this video, for tuning in. If you missed this live, this stream will be available on my channel. Welcome everybody once again to Healthy and Happy by KDL. That's me, Kai. And I don't want you to be confused. Let me rename myself to my nickname. Yes, KDL stands for Karen Dayan Legaspi. That's my full name. My friends call me Kai, so I'd like to use Kai. So it's short and it's easy to remember. Um, okay, guys, before we start, I'd like to thank you once again for always dropping by in my YouTube channel, watching my videos. My videos are mainly anything health and wellness because myself, I've been struggling for many years, like my weight yo-yos, and I'm not really into per se. I really want to become like a supermodel or something. My number one aim is really to be healthy, and weight is of course an effect to your healthy living that is secondary. So I really want to promote that. And you can find that in my channel. So I feature recipes here. And today, one of my playlists, which is health and wellness conversations, I already have 2 episodes before. And now this is episode 3. And I am very proud and honored to have Dr. Ian. So, without further ado, let me introduce you to our guest, Dr. Ian Fruto Teodorico. Uh, please, Doctor, are you in? Is our doctor in? Okay. Hi, Doc. You have to unmute yourself. You are muted. Unmute yourself. I muted you.
There. Okay, good afternoon everyone.
Hi, thank you.
Ate
Thank
in
you.
Cebuano, mayong hapon.
Yes, maayong hapon sa tanan. And also I forgot to mention I am also from Cebu, taga Mindanilya ko. Hi everybody. Yeah, I've been based here in Singapore. We have some people tuning in hinay-hinay, so I'll be the one to look at if they have questions for you, Doc. But everybody, let me introduce to you Doc Ian. Professionally, he is a board certified internist, allergist, immunologist. Familiar siya nako, pero pwede explain gamay, Doc, unsahan gid ni siya. currently practicing currently practicing in Perpetual Soccer Hospital in Cebu, Cebu Velas General Hospital, and Visayas Community Center. So sige ka og labang-labang in a day, Doc, to go to these hospitals, or you have schedules in a week to be there?
My main hospital base is Perpetual Soccer Hospital. Right now, I'm currently affiliated with, as you mentioned, Perpetual Soccer Hospital, Cebu Village General Hospital, the UC Medical Center,
Mm,
now
you
the
see.
Dente Soto Memorial Medical Center, and also the Visayas Community Medical Center. Actually, a total of five.
Oh,
For the other
okay.
hospitals, I don't have clinics there, but I do have admitting privileges. So if in case a patient gets admitted requiring my services as a subspecialist, I get to be there as well.
Oh, okay. That's really, really good to know, Doc. And Doc, before anything
Yes,
else, I really want to thank you for agreeing to speak here, allocating some time. And also we thank one of your technical staff there who's also a doctor.
Dr.
Can you mention
Alex.
the name, Doc? Dr. Alex? A heart
Shout
doc.
out to Dr. Alex Hunia, ex-president of the Philippine Heart Association.
Sus
He's
ka
a big timer.
sus big timer man ang ato ang tig-kuan sa Zoom na sa diha sa Cebu, Doc.
Yeah, I
Doc
made him a
Alex.
technician.
Doc Alex, hello. Thank you so much. Maybe we can do a live to Doc Alex. Makontak ko nimo soon. I'll
Yeah,
ask
you have
Dr.
to.
Ian. Ayan. Doc,
Yes,
I heard like right now you are very busy with vaccinations and besides your practice you have vaccination drive, res bakuna. In fact, your profile sa FB when I first met you, kita dayon ko uh, vaccination, COVID-19 vaccination advocate, and then
yes.
um, can you let me know kung unsa nimong role and your responsibilities and asam kadapita para makita kanila, Doc, pangitaon kanila basin gusto nila ana o pa-vaccinate nimo gyud, miski taga Karkar
Well,
mo ana gyud nimo din sa Cebu City.
okay. Since the pandemic started last year, uh, 2020, I was busy with inpatients no diagnosed with COVID because sometimes if
Mhm.
they reach the moderate severe, they require immunomodulators. But for this year, 2021, in the first week of March, we have begun our vaccination drive
Mhm.
nationwide. No, in Cebu we started last March 3. Being one of the board certified allergists here in Region 7, no, there are 8 of us. 2 of us are internists, that means doctors for adult patients, and 6 of the rest are pediatricians.
Mhm.
It is upon us no to help educate the public on the possible adverse effects, reactions for the COVID-19 vaccines.
Doc,
And
itra mo kabuok, excuse me, itra mo kabuok sus kadaghan
here in Region 7,
in
actually in the entire nation, we, the board certified members of the Philippine Society of Allergy, Asthma,
Mhm.
and Immunology, we call it PSI in a shortcut. There
Yes.
are only I think 136 of us, and 75% of those are in the National Capital Region. So here in Cebu City, there are only 8. 6 are
Oh,
pediatricians and 2 are internists. So we are hard to find.
so that's why we really have to abide kay atong doctors, we have to protect too. Who will protect us? Who will help us, you know? Sus na touch ko. Doc, thank you so much for your service. All the doctors, the nurses around the
Uh,
world sa Cebu City,
so as I
everything.
was saying,
Oh.
since the vaccination drive started, no,
Mhm.
I'm one of the more active allergists. The
Okay.
4 major institutions that I'm affiliated with, I help supervise the vaccination centers, particularly the last station wherein we are supposed to observe those who receive the vaccine for at least 30 minutes. We monitor those who exhibit
Okay.
or manifest adverse reactions. No,
Okay.
since it is along our line, even the other doctors with the other subspecialties they refer to us. So
Mhm.
that is what has been keeping me busy in the past 3 months actually. And on top of that, we also are active in the information campaign to help convince everybody to receive the vaccine. But of course, we are following a priority schedule. We're currently serving frontliners, seniors, persons with comorbidities, and now essential services.
Okay. Yeah, that's really really good to know, Doc, that the vaccination drive in Cebu and of course, I think also the rest of the Philippines is also ongoing.
Yes.
There are different. Sometimes there are different systems, but the most important is it is ongoing. So in line with vaccination, Doc, I have some questions for you. So,
Fire.
uh, shoot na ko sa akong questions.
Go.
um, so around the globe, like I said, like you said, vaccination is ongoing around the globe. But everybody is waiting for this vaccine, but there's a common struggle, the struggle of convincing some people who are having fears of having adverse effect of the vaccinations. So actually, miski ako, normal person nga, dili kayo medical kanang field, ingon ana, wala kay ko kahuna-huna ana. Before, I was just thinking, mas na ang vaccination, pa-vaccine na jud ko, ingon ana. Then, when this came forward, a lot of people, they are very fearful of that. Um, can you help give an overview and let people know why they should change their mind, why they should get vaccinated instead?
Okay. So this is really along my line, no? And this is actually what I've been doing in the last 3 months. I'm the perfect person to ask that question. Uh, uh, these days, no, unlike in the previous decades, everybody now has access to social media. And
Mm-hmm.
because we have easy access to social media, things on the internet, even the lay people, those you mentioned who are not medically inclined, have access to medical stuff, no? Particularly medications, diseases, now with the ongoing pandemic. Uh, one of the most one of the most salient major reasons for people not for people who are not in favor of the vaccines, no, we term that as vaccination hesitancy, is
Mm-hmm.
the overwhelming fear of the adverse effects, like what you mentioned. Uh, let's tackle it piece by piece. Since everybody now can easily access through internet, now reading peripherally stuff about vaccines, stuff about medications, unfortunately, not everybody is like us people who are medically inclined. No,
Yeah.
we only tend to understand to up to the limit of where we are capable of understanding. Since if you are not medically inclined, people tend to take things out of context. They just read the side effects, they read the symptomatology, they don't even read the entire paper. So it bolsters the layperson's fear. Now
Mm-hmm.
here, I am I'll try my best, no, to convince you uh, on this online talk.
I'm pro
Uh,
vaccination. Let's convince
Yeah,
us.
for those of your fans and your audience who are listening right now who have not received the vaccine or who still have doubts about the vaccine, vaccination, the concept of vaccination is not a new thing. No? Half of the world's population right now is alive because of a very comprehensive vaccination program. When we were born, there are highly recommended vaccines which a child should receive. No, I am sure most of those who are in their 20s and 30s now have received the measles vaccine, the DPT vaccine, the BCG vaccine, the varicella vaccine. So, with vaccination, we are able to attain what we call immunity to a particular disease even without getting sick from it. No? So, the concept of vaccination is not really new.
Mm-hmm.
However, the diseases are always progressing, always in evolution. So there are new diseases, we have to study them, and then we develop new medications, new vaccines.
Mm-hmm.
Now, zooming in on coronavirus, so that's why it's labeled as novel coronavirus, no? SARS-CoV-2. It's new. So the vaccines for this are also new. There are
Mm-hmm.
several vaccines now available in the market, some using old technology, like the one used for Sinovac, and Sinopharm, and some are using brand new technology never used before, like the vaccines under Pfizer and Moderna,
Mm-hmm.
which we label as mRNA, no, messenger RNA vaccines.
Mm-hmm.
Now, people tend to exhibit fear of the unknown. Since this is something new, there are individuals whose fear overpower better judgment. Now, even if the expert or the people who know about it expound on it, explain on it. Now, adverse effects in general for medications, for vaccines, are actually very uncommon. They're in fact just a small proportion of the population who receive them.
Mm-hmm.
Not all adverse reactions are allergic. No, let me differentiate two. There are two types of common adverse reactions. We term them as reactogenic side effects and allergy. Now, to differentiate the two, like I mentioned earlier, not all reactions are automatically classified as allergy. There are some patients after receiving a vaccine they experience on the first or second day fever, headache,
Mm-hmm.
pain at the injection site. Those are not allergic manifestations. Those are actually what we call reactogenic side effects. That
Okay.
means your body is acting, building up an immune response to the introduction of the vaccine because your body will recognize the antigen from the vaccine as something not part of self or something foreign.
Mm-hmm.
So our immune system, especially if you are young, you have an overload of cytokines. So these are the biochemicals in the body which help promote an immune response. Especially if you are young, you tend to exhibit these side effects. No, these are self-limiting side effects. We should not be afraid of them. In fact, this is a clear indication that your innate immune system is up and about, running and normal.
Working.
It's working. Yes.
Okay.
No? Oo. Uh, Immune system is a little more complex than just antibody production, just self-defense, no? So
Mm-hmm.
the immediate acute reaction upon receiving the vaccine manifested as fever, muscle ache, myalgia, body malaise, pain at the injection site. Those are all under reactogenic side effects, and those are self-limiting. Should it happen to the individual who received the vaccine, simple rest, hydration, and if there's a need, if there really is fever or there's severe pain, you may take an over-the-counter analgesic like paracetamol. And after 24 to 48 hours, they are expected to resolve. They are not something to worry about because they are
Mm-hmm.
actually not that morbid.
Mm-hmm.
Now, in the exact opposite extreme, allergy, which is what everybody is afraid of. No, okay, it is
Yeah.
sensationalized over media. Na
Yeah.
we heard somebody died
Everything.
because of the vaccine. Oh, we heard somebody had swelling. No, okay, let me expound on that. Allergy
Thank
is a
you.
hyper response, no, to something that most people are not responding to. Something
Mm-hmm.
that's uneventful for other individuals. So it's a hyperactive immune response. A true allergy can manifest as uh, re- uh, erythematous or red rashes, itching, swelling of the eyes, the lips, and if it is severe, it will involve not just the skin but other organ systems like the pulmonary system manifesting as difficulty of breathing,
Mm-hmm.
bronchospasm like in asthma, and
Mm-hmm.
some will even involve the cardiovascular system. There will be hypotension, they will have arrest. So allergy is a lot more serious than just the reactogenic side effects. But allergy in particular is very rare. For example, in Pfizer, America started doling out their vaccines December of last year. No,
Okay.
Pfizer and Moderna. Uh, this data was presented in an American journal, JAMA. It's available online if you want to verify. They collated the data of those who received those two vaccines the first 4 weeks. No,
Mm-hmm.
they were able to compute the incidence rate for anaphylaxis. Anaphylaxis is our term for the severe allergy, wherein on top of the itching, the rashes, the angioedema, there's difficulty of breathing, hypotension. It becomes a true medical emergency. That's what everybody's afraid of.
Mm-hmm.
Now, they were able to collect the data. They were able to compute the incidence rate. For Pfizer, it's only 5 anaphylaxis incidences per 1 million. For Moderna, it's 2.5. For
Which
the
can
other
be,
vaccines, no?
sorry, Doc, which
Yes,
anaphylaxia, which can be treated also
yes.
when.
Now, those anaphylactic reactions, all of them were non-fatal because they were readily addressed by the injection of epinephrine.
Mm-hmm.
So it is a true medical emergency, but it's very easy to manage. No, that is why in vaccination centers ongoing here in the Philippines, every vaccination center should always have epinephrine ready on standby at the
Mm-hmm.
post-vaccination area. And people who receive the vaccine immediately after, they're made to stay for at least 30 minutes because data has shown consistently that severe allergic reactions and anaphylaxis, they happen usually in the first 15 to 30 minutes. Now, so after that, if the patient is able to graduate from the 30 minutes, nothing happens, they are advised when they're sent home to observe for the next 6 hours, to observe for any complaints of related to allergy. If it
Mm-hmm.
already goes beyond 6 to 12 hours, the occurrence of allergy becomes very, very unlikely already. But still, they are still told to monitor. So
Yeah.
to emphasize, the allergic side effects are not common. In fact, they are rare, especially the serious ones, and they are easy to manage. No, so
That's really
everything
good
is
to
a
know.
risk in this life. No, crossing the street, undergoing an operation, riding a plane. The minute risk of an adverse effect in vaccination cannot outweigh the benefit it provides against the COVID-19 scare. No, I am a doctor who handles COVID cases. I have seen already the entire spectrum from the mild, moderate, severe to the critical. In fact, I have lost 16 patients last year. I
Oh,
have
so
lost personal
sorry.
friends to COVID-19. No, I even have a direct relative who had COVID last month. Uh, it is not a nice thing to experience. It's a very lonely disease. Your relatives cannot come to visit you. And if
Yes.
you die, you have to be buried right away or you have to be cremated. So you cannot argue, no, if you weigh the benefits and the risk, the very minute risk for adverse reaction compared to the benefit of getting the vaccine. Because if you receive the vaccine, all the all the phase 3 trials of the COVID-19 vaccines which have been released, they all show good results, meaning to say all those who received the vaccines, none of them have died. In fact,
Mm.
the vaccines are very good at preventing moderate to severe COVID-19.
Yeah. So
If you
yeah.
get the vaccine,
Sorry, doc.
two things
So
can happen.
yeah.
Yes.
Sorry, doc. Just to butt in with that. So when you take when you have the vaccine already, because some people they debate that, there are still people get COVID-19 even they are vaccinated. So what you are saying is that they can still get COVID-19, but they will not have the severe effects of it.
Ah,
Like
if you are
it would not
already
be fatal anymore. Is that
Yes.
correct?
So
Yeah.
if you are fully vaccinated, means that you received the two doses of the vaccine and it's
Mm-hmm.
beyond 2 weeks to 4 weeks after receiving the second dose, meaning to say you are fully vaccinated, only one of two things can happen. It's either your immune response is so brisk and so healthy that you won't get sick anymore, or if you do get sick, you'll have it milder in a shorter clinical course and you will no longer get to the moderate, severe, and critical stage of the disease.
Mm-hmm.
So it is in fact a life-saving vaccine.
Doc, follow up question.
Yes.
Um, is that one time or you need to get another vaccine in the next few years if COVID is still there?
Okay. We currently do not have the data yet. We are waiting for the data which will come in the next 6 months to a year.
Mm-hmm.
Some experts believe that there's a probability that it might be like the flu vaccine, which in which we might have a booster, annual booster or yearly booster, but we don't know yet. No,
Mm.
we are waiting for the data since we this is a new vaccine. We've just started last for the Philippines here last March, and some areas in the of the globe they've started December. So we are waiting for the data we gathered in the next 6 months to a year, and we will see from there if this thing will require us to have a booster annually or not.
Mm. Okay. Which leads me to another question, Doc.
Yeah.
For example, someone has an underlying condition, like the most common in the Philippines, I have high blood pressure, hypertension, diabetes, and all that. And so, maybe someone has undergone a very major operation. Is that something that they fear too, or like how can they be a good candidate to be vaccinated? Like how do you?
Okay. This is the COVID-19 vaccine intended to prevent COVID-19.
Mm,
COVID-19 is more morbid if you have those comorbidities, particularly hypertension, obesity, diabetes, the male gender, a pre-existing lung disease like COPD or bronchial asthma. So if you have any of these chronic comorbidities, you are at a greater risk for developing a more severe or critical COVID. So
mm-hmm,
you are the patient who should ideally receive the vaccine. These are not conditions which are contraindicated to receiving the vaccine. The only absolute contraindication to receiving any of the COVID-19 vaccines is if you have had an anaphylactic reaction to the first dose of the vaccine, or if
mm-hmm,
you had a severe allergic reaction to another vaccine, which may not be COVID-19 vaccine, but with a similar component or the same excipient profile. That is why, for those patients with an extensive history of severe allergies, particularly to IV medications or to other vaccines, before they get the vaccine, they need to get a clearance from a board certified expert or an authority figure. So, all other conditions, so long as these conditions are well controlled, they are not in exacerbation, they're not in a bad state, they may safely receive. In fact, we encourage all our patients who have these comorbidities to receive the vaccine. In
Oh,
the
okay.
priority schedule, those who are those with hypertension, diabetes, they are under A3. In fact, we are already serving A3 since the other week.
Mm, okay. That's good, Doc. Even my parents, I'm happy that they already have their first jab. And then I forgot their second schedule. So last question about that vaccination
Okay.
before we move on. so they say first jab is preparing you to receive the second jab, which is a stronger vaccine to be placed in. Is that true? And will you have the same effects, the reactive uh, effects? Do we expect the same thing?
Okay. The two doses you receive are the same, but your body's response may be different in second dose. Let me explain. The purpose of the first dose is to prime your naive immune system cells to the antigen brought in by the vaccine. When you say
Mm-hmm.
naive, they haven't been exposed yet. No, they're not aware of that particular antigen. When your body is exposed to it, your body develops what we call an acute immune response, activating the other arm of the immune system, which we call the adaptive immune system. The adaptive immune system is the part that develops specific antibodies to that particular antigen brought by the vaccine. So the first dose is supposed to initiate the propagation of the specific antibodies for that. Now,
Mm-hmm.
in the second dose, which is given weeks apart or even several months apart, your body, up to the first dose, forms memory T cells, which memorizes the
Mm.
structure, the epitope, or the determinant from the first dose. So that if you get re exposed for the second dose, your body is now more brisk in making more antibodies to that particular antigen. So it is a booster. The
Booster.
first
Okay.
dose is the primer, the second dose is the booster. So both are intrinsically essential. Not it doesn't mean to say the other one is not as important as the other, and it's a wrong concept to say that the second dose is stronger. No, it's actually the
Okay.
same. What is stronger is your immune response. So when I mentioned earlier that some people get headache, get tired, they get body malaise, they get pain at the injection site. If you experience that at the first, your body, by virtue of your memory T cells, your body will still remember it in the second dose. That's why in the second dose, your body will build a more robust immune response. The symptoms might be more prominent. So that's why they say, mas grabe, no, it's worse. No, it's not actually worse. Your immune system is already in full function and it recognizes it.
Praise the Lord. Salamat, Doc. Now I know properly. All right, Doc. Thank you so much for educating us and move.
Happy to help.
Yeah, before we move on to our next topic, very exciting one. I'm so excited for everyone.
Yes.
Let me just acknowledge everyone who visited us,
Okay,
who's
go.
here. So we have friends from Abu Dhabi, Kuwait, my family in Abu Dhabi, my brother, and
Hello.
my dad is also watching. And my
Hi.
mom and my friends in Kuala Lumpur. Hi, Melchor, Princel, and architect Randall. Hi, architect. Thank you for tuning in. Okay, everyone. So, Dr. Doc Ian, besides being a doctor by day, no, ano siya sideline, no. Besides being a doctor by day, he is also a vocal health mentor. And he is currently he is a vocalist for the Power of Three band, which is a crossover vocal band which delivers top-notch vocal entertainment for all kinds of events there in Cebu. And Doc Ian also sings at a wedding and special events since 2002. And I don't know now, he's very busy with vaccination. That's a priority. um, and then again, he is the vocal health mentor of the Sinulog Idols. Woo! And the WCOPA singers contingent of Cebu. They are the World Championships of Performing Arts. And then
Yes.
formerly a world-renowned UP singing, a member of ambassadors in 1996. Also a former member of UP Diliman ROTC Chorale. And then pioneer graduate of Center for Pop Cebu Voice and Stage, cast member of local musical production of Les Miserables 1996. Wow! Merchant of Venice. My sister likes
You
plays.
mentioned the year.
Doc, I never asked your age ever since I met you. And it's not very evident. You look so young. Artistahin, Doc. Don't worry. And then best performer for the MTV Ikaw na Doc at the 42nd Annual National PCP Convention in Manila. Di na ako ibutang ang year. And then currently, The Power of Three, they have 4 cover singles released, available in Spotify, Apple Music, Amazon, MP3, Line Music, Google Play Music, and Deezer. And later on, we will share that. We will share one song to everybody. But right now, I will let Doc Ian share his presentation because we will talk about voice health. And this is not only about um, for singers. This is for people who is making a living using their voice. Atong mga BPO industries, atong mga our teachers, everybody who's using their voice, ilahang puhunan how to take care of it. Doc, take it away. Share na your
Okay.
presentation and
I will share my
talk about
slide.
the voice health.
Okay, where was I? Okay.
Yep, we can see it.
Okay. Is it clear now? Ayan. Okay, do I
Very
start?
clear.
Okay. I have given this talk since 2016. No, I was commissioned by friends here in Cebu to help do vocal mentorship to the singers of Sinulog Idol, to some of the singers of the Cebu contingent for the World Championship of the Performing Arts, as well as for some of the cast members of some of the local theater groups here. This was initially intended for singers, but uh, the concepts in this talk can actually help any profession which makes use of the voice. No, teachers, lecturers, orators. So here, I aptly titled the presentation as "The Do's and Don'ts to a Healthy Voice." This slide just shows a picture of a gig we had last 2014. I sang for a wedding of a colleague, a medical colleague at the Marco Polo Plaza in Cebu. So several studies have shown that most bad singers can discern musical notes perfectly well. No, here in the Philippines, the rough estimate there are 4 out of 5 Filipinos who can sing, and half of those who do sing do it very well. So for those of you watching and listening to this, I don't know which proportion you belong to. Hopefully not in the 1/5. 4 out of 5 can sing. Hopefully you don't belong to the 1/5. No, so singing is such a big thing here in the Philippines. No, if you look at social media, if you look at the TV and the radio, there are contests everywhere in each station. Videoke is part of every gathering in the Filipino home setting. Even our Southeast Asian neighbors, no, Malaysia, Thailand, and of course our closest rival in the music industry, Korea. So uh, we cannot stress the importance of singing. No, it's something that Filipinos cannot do without. So
Mhm.
for some people who have a problem with singing, they always ask this question: Why can I not sing? So there are major factors affecting the singing potential. First, of course, is what we call musical training.
Okay.
Bad singers or people who do not know how to sing, they actually lack musical training. So about 20% or 1/5 of the people don't have good motor control of their vocal muscles. And about 35% have difficulties matching their own voice to the desired note, but they can match the pitch on an instrument. So I'm sure you probably know of people who are very good at playing the guitar, the piano, but they're not so good with singing. No. Now, that just goes to show that they may not have focused on the singing more, but more on the instrumentation. So musical training is essential to help you learn how to sing. Another is, of course, genetics. No, there are individual differences in biology. Some people are physically better equipped to sing. The structure of the vocal cords, the larynx, or what we call your voice box, and the size of the skull determine how a person sounds. No, so there are people. Not everybody can sound like a Regine Velasquez or a Lea Salonga or a Martin
Mhm.
Rivera, but each of us have our signature sound. No, the vocal timbre is unique to everyone. We might have similar timbres to other singers, but because of our anatomy, no, the different size of the nose, the pharyngeal area, the resonators involving the sinuses, we have a different timbre, no, a vocal timbre. Uh, a third major factor is the environment. The ability to make sense of music is present in early life and can be developed simply by being exposed to music in the environment. No, so if you review the life of your friends who are into the music industry or who are musically inclined, you would notice that many of them during their younger years were already exposed to music. They either have a parent who is inclined to it,
Mhm.
or they had a home environment which was filled with music. It can really help. The last factor is what we call the mindset. People feel discouraged when labeled as bad singers. So, because of that, they do not try to sing anymore. Therefore, they do not get better.
Mhm.
Mental boundaries, yes, no? They cause what we call anxiety for some people, long lasting anxiety. Mental boundaries defer people from singing more than physical limitations, no? Other people also na they get so anxious, no, the term stage fright. They may sing well in the bathroom, but if you put them on the stage, the voice the voice does not come out. They forget the lyrics, they
Wag
tend to
ako na
bubble and quiver.
present.
So that's a matter of reorientation, and as to what they say in Cebuano, you have to learn how to magpabaga sa naong. That's also an hard skill, and that can be brought about by practice and training. So we should stop telling people that they cannot sing. Because according to a study, telling children that they are tone deaf can have a negative effect on their self image or self esteem. Children who are told they cannot sing well are less likely to participate in music in the future.
Hmm.
Now, so as I mentioned earlier, no, anatomy as a contribution is a major factor. We sometimes no the differences are because of the anatomical parts. No, we have a different size of the skull, a different shape and size of the pharynx. So some people have a booming voice, some have a shrill voice, some have a natural rasp to their voice. Now, we also encourage people, again, to listen to music. One study showed that growing up in a musical environment strongly influences whether someone can sing well and confidently. Now, there's a question. Some individuals would say, because he's talented. I don't have the talent for that.
Hmm.
Actually, it is true, no? For a minority of the population, there really are people who are born, no, gifted with a beautiful voice
Born
and
diva. Okay.
born diva. They can easily sing well. However, uh, statistical data has shown that still majority of the singing ability is an acquired skill. So if you're not born with it, there is still hope. With training, repeated practice, you can still become a singer. That's why we have an overabundance of singing schools and performing schools here.
Mhm.
Now, there are solutions to these problems, no, based on research. No, if you'd like to look this up on the internet, go look up the Canadian studies done by the Otolaryngology Society in Canada and in UK. It's all there. For the first suggested solution, sing. Singing is a learned skill, so you have to sing. You cannot get better if you do not sing, if you do not repeatedly practice. Through practice, you develop muscle memory. No, so it leads to number two. learn to use the right muscles, improve motor control over your voice. So just like any other motor skill, riding the bike, driving the car, playing a particular sport, it involves muscle memory. So if you repeatedly use it, uh, you will have more skill at you will get better at it. No, there's proficiency.
Mm-hmm.
Number three, you look for low stakes opportunities for singing without feeling judged. No, there are some people who do rush things. No, uh, after just a little practice, they want to try it in front of a big crowd, a big audience. No,
Mm-hmm.
generally we tend to advise young singers, the upstarts, to start slow. Maybe you can start in front of the family or start in front of a mirror before before you start in a big crowd like a concert venue. No, not everybody gets to be a superstar overnight. Most of the superstars that you know of have been through the grind. No, we do not see it. Okay, what we see is the current, but we do not see that they went through a lot of contests. They woke up early in the morning to vocalize. They underwent schooling lessons. No, so you have to find the opportunity to improve your craft.
Mm-hmm.
So number four, that's related to number three, you find opportunities to sing and you find a good singing teacher to guide you through the process. So much like every other skill, this is enhanced if you find somebody who can help you improve, no? A good voice coach or a good voice teacher. Lastly, slow down. Take one step at a time and be patient. The current generation, I don't mean to be mean, but statistically this is supported. Millennials and Generation Z, the walang forever generation, the sana all generation, who have no respect for
Hi.
tenure and time, or everything happens in due time. No, you cannot become great without falling down several times. We learn from our mistakes. So
Mm-hmm.
I hope I am able to get that message across. We have to work hard to be where we are. No, you don't have to be exceptional at the beginning to excel, but you have to be determined and diligent. For my next slide, no, breathing for singing is deeper than breathing at rest. Okay, there are some people who say that singing is just like talking and regular breathing. No, because in singing, no, the diaphragm, this is the main muscle which separates the abdominal cavity and the thorax, which helps in vocal projection. The diaphragm moves about 7 to 8 centimeters with singing. With breathing at rest, it's only about 1.5. So it's a very big difference. Breathing for singing requires more muscle activity than breathing at rest. So it involves your ribs, the back, the abdominal muscles. All of them are active and there's an interplay of those muscles. There is very little muscle activity required for breathing in the resting state. The exhalation phase during singing is also longer than during breathing at rest. And breathing for singing requires more conscious control than breathing at rest. So, breathing when you sing is more of a voluntary control. Regular breathing is automatic and controlled at an unconscious level. And breathing for singing prepares the body for sound production. The main goal of breathing, the regular breathing, is just to sustain life. So, they are very different.
Mm, okay.
Now, in this slide, these are the common concerns for singers and speakers. No? Number one, does your voice become hoarse or raspy when you sing or give a speech? So, most people are not born with a natural rasp. So, there are only a few people with a natural rasp. An example is Brian Adams, Michael Bolton, Janis Joplin. Oh, in Cebuano, pagaw, no? Or karat o pingog. Oh, if you are not naturally raspy to start with and you develop a rasp, that is already an indication something is wrong, no, with your technique, or you may be sick with something else affecting your vocal cords. Second concern, does your throat feel raw or achy and itchy? These things are not normal because supposedly regular singing and reinforced singing should not have any of these symptoms. No, you should not have ache or itch. Now, is it an effort or strain to sing or talk? Of course, at the beginning, singing is an effort. But once you have regularized singing and you are singing within your comfortable range, it should approximate being effortless. If it's such an effort to sing or you're already straining,
Mm-hmm.
even at with just talking, then something is wrong. A fourth concern, do you repeatedly clear your throat? No, in Cebuano, we call it igham, throat clearing. Throat clearing is an indication
I
of
have.
either you have a very dry throat or you have mucus flowing posteriorly at the back. So this is an indication of pathology already. If it is consistent and persistent, maybe you should have it checked. Now, do people comment saying you sound like having a cold even when you think you do not? So sometimes, no, the nasal passages are still part of the resonation for the voice production. So if it's partially clogged or completely clogged, it will affect the quality of your voice and your singing. So if it's already persistent and bothersome, then that's already pathology which needs consultation with a medical specialist. And the last concern, which many singers would like to address, have you lost your ability to sing the high notes? No, here in the Philippines, it's such a big thing. If you can belt, no, that's why uh, in a contest, if you do not belt high notes, the chances of you winning are not so high. Also, they would like to do a Regine Velasquez, they like to do a Jed Modela, a Martin Rivera. So it's siguro 80% of the population here, as well as for foreigners. No, I'm sure there's one singer that I'm following who is excellent at belting, Morissette Amon. No, she
Taga
has impressed
Cebu.
audiences worldwide. No, she's what I call a extraordinary vocalist. She can belt,
Mm.
she can whistle, she can do low notes, she can rap. She's very impressive. No, so belting high notes. Oh, so this slide is just to help everybody understand the anatomy involved in singing. No, so this is, imagine your body sideways, and this is a view, longitudinal view of your body cut in half. This is the mouth closed. In the middle part, you can see that you have your nasal turbinates. That is, those are the tissues inside the nasal cavity if you view them using an endoscope. And if you follow posteriorly, it will lead to your pharynx, to the throat. And here there are two tubes going down, the trachea and the esophagus. I have to emphasize this part now because there is a major comedian who is going viral these days. No, you probably know of her. Her name is Teacher Dan. No, she's a comedian. She's very funny. She tries to teach voice lessons in a using in a comedic manner, and she keeps saying that you expand or you use your esophagus. Actually, the esophagus is not the tube involved in singing. Esophagus is the tube where the food will pass. No, and I mean not to discredit her. No, okay, she's doing it for comedy,
Uh,
for to get things right and to set the record straight. No, for singing, we involve the trachea, the bronchus, the larynx, no, not the esophagus.
okay.
Okay, so this slide just shows you the voice box, no, the larynx, because some people tend to think that, for example, you're asked, "Oh, what do you do in the band?" I don't have an instrument. I'm just the vocalist. I vehemently will disagree with that. Do not use the word "just" because you do have an instrument. Your voice box is your instrument, the larynx. It may not be as hard as the guitar, the drum set, or the keyboard, but being the vocalist, that is your main instrument, no? So everybody should visualize this one. It's not an abstract thing. It is a hard, tangible instrument in your throat. So vocal folds, so the medical term, you have arytenoids. The upper part, you can see it's normal. Uh, then in the lower two parts, the depictions, you can see nodules and polyps. No, these are pathologic swelling of your vocal cords. No, they often affect the quality of your voice and sometimes voice production. So if it's a bothersome problem, we need to refer them to the ENT people. If you tend to misuse your voice or abuse your voice, you tend to develop nodules. Now let us start with the do's and don'ts, which is the heart of this very short talk. The first do, drink water. The body needs to drink at least, ideally, 6 to 8 glasses of water to be able to function optimally, which includes healthy voice production among the other benefits. So water optimizes the throat's mucus production and water aids in the vocal fold lubrication. So if you watch the professionals when they rehearse or when they do a concert, you would notice that they have nearby on a near the instruments or on a small table at the side, they have mineral water bottles ready. Because after a
Mm.
long set of singing several songs, they drink water. And even during rehearsal, no, you drink, you hydrate. This one, a very big don't. Don't drink an excessive amount of coffee, tea, carbonated drinks, soda, or alcohol and milk products, especially if it's within 2 hours before a major show or an extensive show. No, the operative word there is excessive. I'm not telling you not to drink them, but I'm advising you not to take them in excessive amounts. Why? Because these drinks dehydrate the body and they dry out your vocal folds. And some of these drinks, particularly the carbonated drinks and the alcohol, excessive coffee, they tend to worsen acid reflux. Now, zooming in on acid reflux, this is a problem for other people who eventually have vocal hoarseness. No, this involves the esophagus of the tube, which carries the food down to your stomach, where the food enters and begins it where it's broken down by the acid and eventually absorbed in your intestines. The contents of the stomach, not the gastric contents, are not supposed to get back to the esophagus. We have what we call a stricture there, no, the gastroesophageal junction. For some people, due to obesity, due to problems in the anatomy, there's a reflux of acid or the contents of the stomach. So there are some drinks which can worsen it. So to avoid this, if you are within 2 hours for a major show or a very long show, please do not take any of these drinks in excessive amounts, especially if
Mhm.
you have the gastroesophageal reflux problem. In
Mm.
fact, there's a new term for this. No, they came up because sometimes the gastric acid reflux is not just in the esophagus, it reaches the pharynx and the larynx. Now, the ENT people have used a new term. They call it EERD. The old term was GERD, GERD,
Mm.
gastroesophageal reflux disease. The new term now is if it reaches the pharynx and the larynx, we call them EERD, extra esophageal reflux disease. No, the patient is able to perceive a bitter taste in the throat.
Mhm.
Uh, the vocal cords are affected. They have a rasp. There is pain. So that is a manifestation of EERD. Still a consequence of acid reflux. Another do, live a healthy lifestyle, no?
Yes.
Engage in a cardio metabolic exercise. Uh, Take your pick, no? Whether it's walking, jogging, running, playing tennis, swimming, soccer, all of those are cardiometabolic exercises, no? You maintain a healthy diet, no? You are expert at this, no? Because your past two talks have focused on this. And then you should get an adequate time to sleep. For most people, they recommend 8 hours. No, but for me, I'm lucky if I get to sleep 5 to 6 hours as a physician. Oo.
Do you still
Ah,
get a day off, Doc?
you know naman doctors, no, there is no day off because the emergencies will not pick a
Yeah.
time. No, the emergency case will not tell you na, I will not have a heart attack now because my doctor is sleeping. No, so it's 1 a.m. The doctor is asleep. I will have a heart attack in the morning so that the doctor can
It's
see
not
me. No, it
easy.
doesn't happen
Kudos
that way.
good.
No.
Kudos.
Oo. So sometimes ano, it can happen anytime. So another big don't, do not smoke. No? This is a proven strong risk factor for lung cancer and throat cancer. And even beyond the pulmonary system, smoking aggravates 11 other cancers away from the lungs. No, it's not just lung cancer. Smoking also impairs the mucociliary clearance, increasing susceptibility to respiratory tract infections. No, so for people who smoke chronically or in long term, they impair the cilia, no, the microscopic hair in the epithelium of the upper respiratory tract. No,
Mhm.
that's why many people are prone to what we call URTI, upper respiratory tract infections, if they are chronic smokers, and sometimes it will lead even to the lower respiratory tract, like pneumonia and
Mm.
bronchitis. Primary and secondhand smoke can cause significant irritation and swelling the vocal cords, and they can even permanently change your voice quality. Because there are singers who smoke, no? But you know, if the
Yeah.
smoking is really very extensive, you would compare, no? Decades ago, the voice used to be crystal clear and pristine, and now in the later years, the voice became raspy. They can still sing, but the quality is changed. So it's a very strong recommendation not to smoke because of all those ill effects. Ito, do. Warm up your voice before heavy voice use, no? I am not a vocal coach. I am not a voice teacher, no? If you require a vocal teacher, I have so many friends who are good at it. No, those who are formally schooled in classical music, voice majors. Oh, I am not. I will not presume to be one. Although, with my perspective, I can maybe give a few advice about it. But if you really want an extensive training, we can refer you to the specialist, no? The board certified music majors, voice teachers. Ideally, singers and professional speakers should do warm up like vocalization exercise and lip trills. Now, you know what lip trill? That's an example, no? It
Mm,
improves articulation and breathing. It can improve your vocal range and your volume control. It can improve your vocal stamina. What does that mean, no? Some people are very good at singing just one or two songs, no? But if the song is difficult or the song is requires a lot of skills, they cannot last long, no? Mapagaw sila, or they lose their voice in the third or fourth song. So if you warm up your voice adequately, you're able to sing a lot of sets, no? More than just a couple of songs, no? And vocalization will also help you improve your vocal skills, no? Uh, Belting, vibrato, passaggio, and then just like any other muscle in the body, a warmed up muscle contracts better, contracts faster. So just like other athletes, no, you observe football players, basketball players. A good coach will always warm up all his athletes, no? Singers are what we consider as vocal athlete. So the warm up brought about by your vocalization exercises can essentially prevent vocal strain. Because if you immediately sing something, especially if it's a difficult song and you did not warm up, you have a considerable risk of incurring injury to your voice.
mm,
Don't. These are for the people who are fond of going to dense bars, no, places where there's a congestion of people. So don't abuse or misuse your voice. No, avoid habitual yelling, screaming, or cheering, and avoid talking loudly in locations with significant background noise. No, if you've entered places like this, now you tend to auto-regulate. Now you speak louder than usual, and if you speak louder than usual and you tend to shift on your throat muscles, you become guttural, and that's not a healthy way of talking or singing. Eventually, you will have vocal strain. Another do use a vocal amplification system. No, if you need to do a lengthy rehearsal for a show or a talk or a concert, use vocal amplification system like a microphone will help you prevent vocal strain, no? I'm
mm,
sure you've seen a few videos when the singers will rehearse days before the concert. They're in a padded room. They don't sing without they sing with microphones, with the water at the side, there's a speaker. Because there are some people who do a lot of rehearsals. And if you don't use an amplification system, you tend to sing using your maximal volume. So
mm,
when the time comes for your show, you're already either too tired or stressed vocally. You have lost your voice all because of the extensive rehearsal without the amplification. So ideally, if you can avail of it, do use a good vocal amplification system when you do a lengthy rehearsal to avoid vocal strain. Don't clear your throat repeatedly with excessive force. Forcibly clearing your throat can be compared to slapping or slamming the vocal folds together. No? Consequently, excessive throat clearing can cause vocal fold injury and subsequent hoarseness. So vocal throat clearing is like this. Some people like doing that. No, should that happen, an alternative to throat clearing, you can take small sips of water or by simply swallowing to clear the secretions of the throat. However, this is a red flag sign. If your throat clearing is incessant and involuntary, it's already bothersome, or if it's associated with other symptoms, there's already pain, there might be blood in your phlegm, or you are having fever, it is best to consult a physician because there's already an ongoing pathology there. That's already a throat clearing that might be due to a postnasal drip problem or a primary problem in the pharyngeal area. Do use good breath support. Remember, the lungs are the power behind the voice, so take time to fill the lungs before starting to talk or sing. Again, do vocalization exercises for proper breathing and tonal placement. Recurrent coughing, shortness of breath, or chest tightness should already warrant a medical checkup. So, coughing is never a normal thing. Chest tightness, shortness of breath, or the medical term is dyspnea, Those are not normal things, no? Should they happen and should they persist, all of those already warrant a medical checkup. You might be a patient with asthma, COPD, bronchitis,
Mm.
or an upper respiratory tract infection. Do listen to your voice, no? Apart from people who are helping you improve, your voice teacher, your close colleagues, you are the best person to gauge if there's a change in your voice, no? Because you hear your voice every day, you auto-regulate. So you learn to listen for subtle adverse changes in your voice. You modify and decrease your voice use if you become hoarse, no, in order to allow your vocal folds to recover. So, for example, I will make myself the example. No, I belong to a group, Power of Three. Usually, we usually sing during dinner time, two sets, or sometimes we sing the last third set on the end. We distribute our songs. Now we don't sing all our difficult songs in one set, so that we can rest in between. uh,
Mm.
we, we reserve the more difficult songs when we are already adequately warmed up, maybe in the middle part or when it's the highlight of the dinner time. So we do not sing them all together or one after the other. No, we need a break so that you can perform up your optimum vocal capability. So the
Mm.
general rule for singers is you sing songs within the tessitura. The tessitura is the term for your comfortable range, no? Leas longest term is your vocal sweet spot. If
Mhm.
you are an alto and you sound best or your tone is brightest in the alto range, sing songs in that range, no? Not everybody can sing in the range of Regine Velasquez, or not everybody can sing as low as who is a bass singer and who's popular. So learn as you go through training, as you continue to sing, it is something that you will uncover, no? Your tessitura, your comfortable range, no? So learn to pick songs in your comfortable range because that is when your vocal sound, no, is at its brightest and most pleasing to the ear. More on the listen to your voice. Frequent and persistent hoarseness should be evaluated by a physician. And there are conditions which lead to the hoarseness. Now, this includes, of course, infections, bacterial infections or viral infections, acid reflux, which I mentioned earlier, and of course, overuse. No, so that's why I emphasize warming up, spacing of difficult songs, resting in between. A very uncommon cause of vocal hoarseness is also cancer. No, of course, that already warrants the specialist. I'm not sure if this is my last slide. Oh yeah, this is my last slide. No, this is a picture of my group, the Power of Three, Teapot. That's T_POT. That's me, Daryl, and Wilson. And behind us, he's not in the picture, Jude Gitamundok. He's our keyboardist.
Okay, thanks so much,
Okay.
Doc Ian, for all those tips. So, guys, again, it's not only for singers, but also for people who use their voice a lot. And thank you for the tips, Doc. And everyone, you can just replay again if you wanna check the tips of Doc Ian. And um, before we end, we would like to show you Teapots or the Power of Three cover song, if ever uh
You're in.
you if ever you're in my arms again. It's so funny because I've been tuning to that song, and you know about last song syndrome.
Yeah.
It's not getting out
So
of
you
my
got
head.
hooked on our version.
Kana nga version good, and it's so good, guys. I would really encourage you to support our local artists, and they're on Spotify, Amazon, Google Play. What else? Doc, can you
Okay,
say
I'll
more
talk
about?
about that.
Yeah, can you talk about that song before we share to them now?
Okay, for the listeners here, if you'd like to support us, please do subscribe to our channel. We have a YouTube page under the Power of Three, T_POT. I also have a Spotify account, a solo account, and an account from my group, The Power of Three. Under my account, it's under my name, Ian Fruto Chodorico. That's IANFRUTOTEODORICO. I have two song covers and one original song composed by the great Jude Gitamundok. And for the Power of Three, we have two cover songs, no, as mentioned by Kai. We did a rousing cover of "If Ever You're in My Arms Again," the power ballad of Pibo Bryson. We also did a cover of the Broadway song "For Good" from the musical Wicked. Hope you like
Mhm.
our version. Today, this year is our 10th year as vocal entertainers here in Cebu for the Power of Three. So hopefully, we will release our original track before the year ends. I hope Jude will be done making the song.
Wow, I'm
I
excited
hope
with
you guys
that.
will support
I-share
us.
dayon so i-share dayon daw ka.
Yes. So we are on Spotify, Apple Music, Line Music, Amazon, MP3, Google Play, and Deezer. But here in the Philippines, I think the popular ones are Spotify and Apple Music. So I hope you
Mm.
will support us.
But it's good
See,
that you're
Kai,
all in the platform. Nag-download na ko, Doc. Nag-download na ko.
oh, thank you so much. Oh, so I think we'll be playing our performance video. I hope you guys
Yes.
will like it and support it. Do
Yes,
share it
before
in your
yeah,
timelines.
before we play, again, thank you so much, Doc Ian, for your time. And I wish you success and also keep safe. And we will continue to pray for you to help, fight COVID. Everybody, let's help each other fight COVID. And also for people like our topic earlier, for the people ng ilang puhunan is boys, take care of that because that's our imunang way of living. So you must take care of it. So whether you're a singer, teacher, BPO, basta
Yes.
voice mo puhunan, take care of it. And then so we leave you this song, If Ever You're in My Arms Again. We will
Yeah.
turn off our cameras already so that you can enjoy the music
Okay.
video. Enjoy, guys.
Thank you so much for having me, Kai.
Hi, everyone. Just trying to share uh, my screen first for a moment. Thank you, everyone, for tuning in. Okay, I'm having some technical matters here. That's normal whenever we're live. Let me just open. Um, Instead of from my computer, I'm going to open it to their page. Why not? That's easier. Okay, sharing now, and we will click play here.
I'm Daryl.
I'm Wilson. We are the Power of Three, T-Pop. We're looking really cool with our animal art shirts, all the way from Bangkok, Thailand. We thank you for listening to our cover of If Ever You're in My Arms Again. If you like what you heard and you would like to hear some more, you can look us up in Spotify, Apple Music, Line Music, Deezer, Amazon, and Google Play. So please do support us.
Kamsahamnida.
Kabun Kap.
Sheshe.
Salamat po. Bye.